Welcome to A Higher Future in Healthcare, where we're exploring obstacles and solutions to healthcare's growing workforce demands. Tune in to hear from thought leaders as they share their perspectives on strategy, technology, AI, and people who are paving the way for transformative change. Hey everybody, welcome back to A Higher Future in Healthcare, and this is part of our special series on AI in healthcare. And we're really excited because this is the final episode in the series. And I think our goal is really to kind of pull everything together from our previous experts and provide some suggestions on where AI could really be impactful in a positive way in healthcare. And so I want to welcome Dr. Dinesh Rai to this episode. How are you?
Oh, I'm doing really well. How are you?
I'm good. I'm good. It's great to have you here. Thank you. And tell us a little bit about yourself, because you have sort of a really unique background as an MD, but also you're an AI engineer. So can you tell us a little bit about, your background, how you got to that point, what you're doing now, and then we'll dive into kind of your views on AI and healthcare.
Sure, of course. I guess like just historically, I always like dive deep into anything I'm interested in.
Yeah.
So I actually started off as like a business major in college, decided to go to med school, did a postbac, um, and started med school in the Bronx at Albert Einstein. And while I was there, 2016, 2017, this is when that first wave of machine learning, neural
Mhm.
networks, finally getting enough data and compute power to train useful models, started getting into the hype cycle. I was very curious. There's obvious use cases to these things in healthcare. Back then, it was largely just related to like predictions, like regression analysis and classifications type of things. So stuff was open source,
Mhm.
educational resources were available, started to learn Python and all the other things that go along with it, some of the data science behind it, and just kind of dove into some projects and built a couple of models during med school, kind of continued my interest during residency, did an informatics fellowship. And after the fellowship, it gave me a good insight as to like how how you can continue working in informatics, you know, while a clinician. So I luckily I'm in emergency medicine, so I took a little bit of a break. It's an easy field to go back to, and
Yeah.
dove kind of head first into the health tech space.
Yeah.
Um, and now this is when large language models started to become a thing. It, the ChatGPT obviously came out about a year ago.
Yeah.
So I joined a company in Dallas, startup that focused on NLP initially for healthcare, and helped them kind of implement this technology into their pipelines, into their summarization process and some of their classification process. And then this opportunity came up to join a large health system, Boston Children's, as
Yeah.
an AI prompt engineer, AI engineer, to kind of help develop some products here. So, seemed to be, something that fits really well with my interests and my background. So I applied, had a couple of conversations, and I'm here now working on some interesting projects.
Yeah, man, that's amazing. And so the connection, did you make the connection early on as far as AI and healthcare? I mean, did you see kind of immediately before you actually like started digging into it how it could be applied, how it could help? Did you kind of, what were your thoughts on that because when you got interested in AI while you were in med school?
Yeah, yeah. I mean, I think it 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 was pretty obvious that there was going to be some impact or some potential impact at least.
Hmm.
Um, with these prediction models, the benefit is that you can throw a lot of data into it and it'll find patterns, and insights that you may not realize as the clinician, because it's hard for a brain to handle that much information. So
Right.
you know, one simple example is, and this may not be something that's in the model, but if there's cutoffs for vital signs, so your heart rate's high or low, that's what we
Hmm.
have. But if someone is at baseline, their heart rate 60, now it's jumping up to 90, that may be within normal parameters, but there's some abnormality going on there. There's a reason that that person's heart rate jumped up, but we don't see that pattern because we're not looking at all the data at once. We're just seeing, is the value red, or it takes like another level of insight or thinking to notice that that jump has happened and that there may be something that's going on that is triggering an elevation in the heart rate. So just having all those patterns and insights like trained on an algorithm, I felt like was going to be a huge impact in healthcare generally.
And so how have you seen, I mean, clearly you've implemented some things. So where do you see this going in healthcare? You know, like what, let's start with maybe where it could go wrong. You know, what, because I know there's, you know, there's a lot of fear mongering and sort of negative messaging around AI. And, you know, I think people kind of get really worried, right, and scared that AI is going to be detrimental in, you know, numerous ways. Um, so, I mean, of those fears, like which ones are you worried about, or where do you think AI could potentially have a negative impact on what people are trying to accomplish?
Sure. I mean, I guess like, one of the major ones is like exacerbating the bias that's in healthcare data right
Sure.
now. Um, Propagating what the data is training the model to do.
Mhm.
So, for example, if you were to train a model on like who gets pain meds at what time, if there's one demographic that because of some implicit bias in the healthcare system got pain meds at a later state or a higher pain level than another, you train an algorithm to now give that person pain meds at a different time than the first person, right? So,
Mhm.
and, and you may be able to take out like the variables that are like very obviously the the factors that can implicate bias, but there's other like small things and like how you write your note or like how many orders you take and things like that that may be associated with certain testing that you may not be able to remove completely from a data set. That makes any sense. So, we really need to figure out how to like remove these sources of biases before we kind of rely more on these models. Otherwise, we're just going to have the same problems we're having now in healthcare.
Yeah, for sure. Well, and you know, one of the biggest kind of ethical arguments is, you know, who's developing the AI, right, in the first place? Because to your point, they're sort of coding in their own biases. So it would seem that potentially a lot of these AI programs or platforms are biased from the start. Like, so how do you combat that, right? How do you mitigate that from the very beginning?
Yeah, I mean, it's hard. It's, the obvious step is to like really clean up your data and make sure that you're trying to remove as much bias as possible in your data. But, who right now is going to be doing those things as humans who have these implicit biases and may not
Right.
even notice that the biases are there. So
Yeah.
I think it's a really hard problem to tackle. Um, it there's a lot of like smart minds that are after it. There's a lot of people that are going to like ethics of AI that are thinking about these problems. So I'm hopeful that we'll have some kind of solution, but I know there's no easy solution right now.
Yeah, for sure. So let's go the opposite direction then and talk about, you know, like positive impacts. Where do you think and where have you seen AI have a positive impact on healthcare already? And then we can talk a little bit about where you see it going in the future.
Yeah, I mean, if you look at some of the um, outputs from these generative models that people are kind of talking about, ambient listening for clinical notes is reported to save a lot of time. I think Epic has an in-basket where it's generating templates for you for answers to patients' questions, saves a lot of time.
Mhm.
These models, there have been studies showing that output from these models tend to have a lot higher levels of empathy than physicians, and that may be a factor of like time again, not having enough time to like say all those things
Right.
that uh, convey that you're feeling what the patient's feeling. In documentation is something that these models have helped out with as well. I think a lot of it just comes down to like saving time and like reducing the effort that goes into those things that are not entirely just like clinical based or like
Mm.
reasoning and things like that, like saving time with documentation, saving times. There's I think Doximity has had a project a while ago where they helped you write prior auths for different companies, and no physician wants to sit down and write prior auths during their clinical day. So
Yeah,
that's
right.
again saving time. I think that's going to be like one of the first things that kind of come up and are going to benefit the healthcare system as a whole.
Yeah, I mean, I think that time savings, that efficiency is huge, clearly for so many reasons, but considering the fact that, right now, I think a lot of hospitals are having trouble keeping up with the staffing needs.
Mhm.
And so to be able to supplement that with these time saving programs, yeah, to your point, whether it's documentation, whether it's in the hiring process, um, that's really cool. The empathy thing's really interesting. Where does that come from, do you think?
I think that's coming from how the models are trained, right? Like
Yeah.
they're trained on, these models are trained on vast amounts of data, the internet, for example, and
Hmm.
they're fine-tuned based on human feedback. So models that if we're trained on humans that are picking the more empathetic response over and over, probably are going to lead to more empathetic responses. Like
Hmm.
I'm sure if you trained on strictly like medical text, that the empathy will not be
Right.
there because that's we don't spend the time to write that in our documentation a lot of times. Um,
Yeah.
so that's my guess. I don't know how. I'm not in these companies that are training these models, but that's probably how they're doing it.
Yeah, that's fascinating. Um, what else, like, what do you see in the future? So this is sort of the first near-term impact, which we just talked about. Where do you see AI really coming in over the next few years and making a difference?
Yeah, I mean, I think in the near term, we're probably going to notice a bigger difference in like the back office things, like again
Hmm.
writing notes and claims type of activities with insurance companies and whatnot. Um, but ultimately, as like probably down the line, like a diagnostic partner positions of like, hey, did you think about this? Did you think about that? Should we order this test for this patient? What I'm really excited about is going through and like finding patterns and associations that we can do studies on that we may not notice otherwise.
Right.
Aspirin was initially a pain med until a physician, I think in the 70s, noticed that his patients who have had heart attacks that are on aspirin are not having second heart attacks as much. And
Hmm.
then they did the studies of showing that aspirin's beneficial for those, that test,
Sure.
that patient use case. So I'm sure there's like all these different associations that we just can't, we don't have one physician looking at enough cases to like make those associations and
Yeah.
doing those studies to verify them. So that's another exciting thing I think AI will down the line help out with.
Yeah, that's really cool. Well, and that's, I think one of the biases that keeps us from, realizing that is, and I look at this from like a hiring and interview perspective, because I think, a lot of people are like, well, I've been hiring my whole life and I just go with my gut. Well, sure, but have you tracked your success versus not, right? And
Mhm.
I think we get in the way of ourselves a lot when, if we just step back, we could really see, to what you just talked about, this idea that there's no way one person could take all the studies that have been done in a reasonable amount of time
Mhm.
and correlate all the different things, um, that we don't see on normally. AI can do that for us and fast,
Yeah.
and that's what's amazing, right? Like think about, I don't know, it's just amazing to think about a lot of, how many people could have been saved by the, using this type of technology or this approach, or could we have, developed different types of, medicines or vaccines or whatever. I just think it's quite fascinating, and why I think it's so important that we need to change the conversation around AI, because there is too much fear mongering right now. And I don't, I think that's just a power and control thing that, the people who are spewing the fear are trying to control
Yeah.
the situation. But in reality, there can be a lot of great impact here. One of our other guests, Beth Rudden, who owns Bast AI,
Mhm.
we talked about the AI assistant that you had mentioned, right? The ability for a nurse or a physician to ask this assistant, hey, should we do this? Should we consider a different form of treatment? Um, that would be really interesting to me. I think everybody could do it with an AI assistant, really.
Yeah, yeah, yeah. And they're getting more and more useful, you know. Just like I I use multiple assistants a day nowadays just to
Right.
like do research and brainstorm and write things out. I think the healthcare field just needs to be a little bit more vigorous in
Hmm.
ensuring the output's decent, which is a hard problem in and of itself. Like,
Right.
what's a correct output when it's a text? And there's so many different ways you can go that are correct and incorrect with generating text. It's just exciting to see all the things that are happening so quickly.
Yeah. What are your thoughts on all the legislation that's started last year and kind of moving into this year? There have been a lot of bills, either presented or passed related to AI in business. What are your thoughts on that?
I'm not all that familiar with the legislation. I know there was like a big push last year to kind of like to have US companies like pause research in
Mm.
AI for 6 months to figure out like, how we're going to control these things. But
Yeah.
people are going to continue doing research. They're going to continue building large models. Um, these models are open source already, so it it I think, we can't pause research, but we need to at the same time think about how we're going to control some of these things.
Yeah, for sure. Just like anything. And I mean, a good
Yeah.
thing is I think healthcare is already used to that, right? I mean, there's a lot of compliance that goes into healthcare.
Oh yeah.
And so I think it's sort of built in, right?
Yeah, yeah. I mean, you need to prove that the thing is going to work. You need to then
Yeah.
prove that doesn't have a negative effect. And there's all these different, like, the FDA process has all these different clinical levels of clinical studies that you need to go through. And I think the same thing is kind of going to happen with this AI technology.
Yeah.
Um, there are some things where, do you really need to go through the entire process if you're making a small change to your model? It's up for debate, I think.
Yeah.
But I think we're going to adapt and learn.
Yeah. Awesome. Well, Dinesh, I can't thank you enough. I'm excited for the progress of AI in healthcare, and I think it is going to make a truly big impact, particularly in the near term. And also, you're doing a webinar with Beth, who I mentioned, and our CEO, Joe Thurman, on I think it's February 29th, right?
Mhm.
What are you guys
Yeah,
talking about on that webinar? Kind of the
I
same
think kind
stuff,
of the
right? I
same
mean,
stuff.
yeah,
Yeah,
just kind of going over um, AI and I think it's a chance for the audience members maybe to ask some questions too. So hopefully they'll listen to this episode in preparation for the webinar, and then
yeah,
they can come prepared with some questions. So,
exactly. Do
well,
your
Dinesh,
homework.
again, what's that?
Do your homework.
Do your homework. That's exactly right. Well, Dinesh, I can't thank you enough. This has been awesome. Any parting words of wisdom?
I think, em embrace the exciting future that's gonna be coming up on us soon. I think there's a lot of potential for things to go right. So, we should be focusing on getting to that future and avoiding the other future where things can go wrong.
Absolutely. Awesome. Well, thank you. And thank you, everybody, for tuning in. We will check you next time.
Awesome. Thank you. Bye.
A Higher Future in Healthcare is a production of IIA Healthcare, a healthcare technology company and creators of Interview IA, an interview platform for healthcare organizations to streamline their interview processes to deliver unparalleled candidate experiences and to create a true competitive advantage for delivering quality care. Learn more at www.iahealthcare.com.